Welcome to today's webinar. It is best practices for breast cancer screening. And before we get into it, while we're just waiting for people to join, I'm just going to go over an upcoming webinar that we have in 2 weeks from today on Tuesday, October the 6th at 12:30 p.m. The next Medcan Presents webinar is explaining the annual health assessment. Medcan's annual health assessment is one of the best available ways to get a complete picture of your current health and immune function. It's about a 5-hour visit to Medcan. So if you've never had one and you're curious to learn more, this webinar will be a great way to understand what's involved with it. It will be hosted by Dr. Peter Nord, who is Medcan's Chief Medical Officer. And if you have any questions in advance of the webinar, you could email those to chris.shulgin@medcan.com. And to register for the webinar, you can see the link on the screen right there. You can also find past webinars. We house all of them on our YouTube channel, and that's at youtube.com/MedcanLiveWell. So welcome to today's webinar. It is best practices to prevent breast cancer with Medcan's Dr. Janice Weiss. And I am Chantel Guertin. I am hosting this with Dr. Weiss, and I just help to run the content and create these webinars for Medcan. So Dr. Weiss is our expert today, and she is Medcan's Director, Child and Youth Program and Continuing Medical Education at Medcan. She is a family physician with 35 years of clinical experience, and in 2015, she became certified as a menopause practitioner with the North American Menopause Society, and she speaks regularly about menopause to both lay and medical audiences. She is also a consultant to the National Ballet of Canada. So welcome, Dr. Weiss. Thank you for being here today.
Thanks, Chantel. It's a pleasure to be here.
So I'm very interested in this topic, particularly as a woman, and I'm sure many of our attendees are as well. And I think with October being Breast Cancer Awareness Month, it's kind of a timely time to talk about breast cancer, especially because 1/4 of 2020's new cancer cases in females will be breast cancer. And I think many of us know that breast cancer is a disease that will strike 1 in 8 Canadian women. With COVID, though, I think it has affected people for preventative health care, which is something that Medcan is so concerned about because it's such a great way to be on top of your health. So can you speak to that? How has COVID affected breast cancer screening and prevention?
Yes, yeah, it's a great question. It's really relevant with what's going on today. I think everybody is so COVID focused that a lot of people have just forgotten about all the other aspects of healthcare, which includes cancer prevention screening. So when COVID first started and everybody, hunkered down and stopped taking care of any of their testing and seeing doctors, etc., we stopped doing routine screening. And we soon realized that this is something that's really important. The mammograms have been reinstituted by OHIP and by Medcan. It's something that I think women have put on hold, thinking it's not that important because it's more important to stay home and not be potentially exposed to COVID in a healthcare setting. But I think that it's really important to rethink that thinking and take care of the preventative health. So we are doing pap smears, we're doing colorectal screening, and we're doing mammograms. So if you're due for a mammogram, don't let that go. Make sure you do it, especially now before numbers may even go crazier. If you're overdue, book your appointment.
That's really great advice. So maybe we'll talk a little bit about what Medcan does differently from the public system for women who are at average risk for breast cancer.
Sure. So we're talking average risk. And just, I guess, to clarify, in the OHIP system, there's the Ontario Breast Cancer Screening Program that you don't need a doctor's referral. You can enter it on your own. And a screening is done on approximately every 2 years with mammograms. For people who have denser breast tissue, sometimes they'll recommend on a yearly basis. Sometimes the recommendation will be for an ultrasound, and it depends on personal, on each individual case. The difference at Medcan for the average risk individual is that we do it every year when you come for your annual health assessment. And the majority of women end up getting breast ultrasounds. And studies really show that a combination of mammogram and ultrasound can pick up more breast cancers, particularly in women who have dense breast tissue. So rather than doing it perhaps yearly through OHIP because of the dense breast tissue, we're doing mammograms and ultrasounds yearly on women with dense breast tissue. And the issue with dense breast tissue is that it's much more difficult for a mammogram to pick up a breast cancer because the cancer tissue looks the same as the dense breast tissue on the mammogram screen. So we need a different modality to differentiate between the two different types of tissues.
Okay. So should we talk a little bit about what the difference is between someone who is at average risk and someone who is at high risk?
Sure. So there is within the, so Medcan should not and does not do screening on high risk women. That should be done through the Ontario High Risk Ontario Breast Screening Program. And that is open for women between ages of 30 and 69. There are certain eligibility criteria that would need to be determined by your doctor and approved by the Ontario Breast Screening High Risk Program. And it involves a combination of a mammogram and an MRI on an annual basis. So the most common reason for being entered into a high-risk program is knowing that you carry a genetic abnormality that increases your risk for breast cancer, or perhaps you have first-degree relative with breast cancer that has the abnormality, but you have chosen not to be tested, or you are at high risk for other reasons. There are other hereditary syndromes that can be identified by a genetics counselor, and there are breast cancer tools that can determine your lifetime risk of developing breast cancer based on family history. So for many reasons, you can be eligible for that program, and it's really effective for picking up early stage cancers with a combination of mammogram and MRI. But that's not what Medcan does. Medcan is a great program for average risk women by adding ultrasound to mammogram on a very regular basis for most people.
Okay. Out of my own interest, is the MRI swapped out for the ultrasound just because it is just like the next level of detection, but it's more expensive or takes longer? Is that sort of the reasoning?
It's definitely more expensive, but it's much more sensitive to picking up abnormal tissue than an ultrasound does. For women where the MRI is not available for high-risk groups, they may use ultrasound instead, but MRI by far is much more sensitive, so much so that it can actually pick up a lot of false positives. So, for example, you can have an abnormal spot on your MRI, but it can be a normal tissue. So they're picking up normal tissue looking as abnormal. So you really want to reserve this test for women who are at high risk and have a higher pretest probability of having cancer.
Okay. So before we get sort of into the lifestyle changes that we can make for average risk women, can you just talk a little bit about breast implants and how that plays into breast cancer?
Yeah, so until recently, there was a commonly used type of breast implant. It was a textured surface implant. And when they were being used, it was felt to be a very safe and a good quality implant. But more recently, it's been shown that certain of these implants have a very rare but increased risk of a rare type of cancer. It's actually not a breast cancer. It's a form of lymphoma that develops in the breast tissue close to where this implant is. So women that have had implants are usually given a documented tag or piece of paper that says what the implant information is, and either look into that, find out if you have a higher risk type of implant, or speak to your surgeon. It doesn't mean that they need to all be removed. It needs to have a conversation with the surgeon. There are effective ways of monitoring breast with ultrasound and physical examination to check for early signs of a problem. So it's something not to panic, but to look into and see if that's the type of implant you have, and then speak to your surgeon about it. Yeah, good
Sure.
point.
Okay. So let's move now into lifestyle, because that's the one thing we sort of can alter our potentially maybe our risk. So how does lifestyle affect your breast cancer risk?
Oh my goodness. It's lifestyle has so much to do with what our risk of breast cancer is for the average risk person. I'm not talking about a person who may have gone for genetic testing or thinks that they may have a genetic abnormality. So for the average risk person, there are different things that we talk about. I'm going to start with alcohol, because that's the type of thing that most women are either in denial about, don't know about, and it's really talked about so little. It's very little in the media about it. So really anything more than 0 alcohol imparts an increased risk for breast cancer. So I'm not suggesting we don't drink. I'm suggesting that looking at your own personal risk factors, your own anxiety level, whether you have dense breast tissue and might make you at increased risk, whether you have other factors other lifestyle factors that increase your risk, you may want to cut back on your alcohol intake.
Mm-hmm.
So it's a linear relationship. The more you drink, the greater your risk.
Okay.
And it's something I talk about with all my clients when they come into Medcan. And most of the time I say, this is something you just never read about in the media. I don't know why. It's just there's not a lot of traction. And the last time I said that, that night there was a great thing on the news. I was like, yes, okay, someone will believe me now. So it is real. You can Google it. All the cancer societies do talk about it. But you have to also look at your personal risk, because there may be potentially some benefit in the cardiovascular world. So if your cardiovascular risk might be higher and your breast risk is lower, everything is a risk benefit. So cut back, modify. Everything's about modification. So alcohol is the first thing. Smoking is an obvious one. Everybody knows that there are risks of smoking and cancer, and breast cancer included. Weight. Excuse me, weight has an impact as well on the incidence of breast cancer, particularly in postmenopausal women. So greater weight after menopause imparts increased risk, in part due to the fact that fat cells store estrogen, and cancers can be driven by estrogen sources. So postmenopausal women and weight, really important. Physical exercise is really important, and it impacts breast cancer risk premenopausally and postmenopausally. We always tell people to exercise, to try to aim for 150 minutes of moderately intense exercise a week, or 75 minutes of vigorous exercise on a weekly basis. And that does have an impact on many cancers, breast cancer included. We talked about implants, diet. Okay, so diet is the other thing. You can get on the internet and you can read all kinds of things, and you can make yourself crazy, and then you end up going back to what you're normally going to eat and drink. So I'm going to make some suggestions based on some more recent studies. And again, what you hear me say today may be different next month. So these are things that are always moving, and research is ongoing. So because you hear one study says one thing doesn't mean you've got it and greatly impact your entire life, throw it upside down and start again. Everything's about modification. You can actually look it up. In the Globe and Mail published a few articles early in 2020 talking about different dietary studies involving diet and breast cancer. There was one study that was published, I think it was around March, and it was in the International Journal of Epidemiology, and it looked at the link between diet and cancer. There were more than 50,000 women, average age of 57, and they looked at women who drank cow's milk versus vegans, or women who drank very little cow's milk. And after 8 years of study, the women who did not drink cow's milk had a reduced risk of breast cancer, which is interesting, because we're always being told milk is such an important part of our diet. We need the calcium for our bones. And the truth is, there are so many nutrients in milk that are so important for our health that I would never in a million years say stop milk. But what I might say is, think about, if you are a 1 or 2 glass milk drinker a day, probably no big deal. But if you're drinking loads of milk, you may want to swap out some soy milk for cow's milk, modify it, depending on the amount you drink. And again, the calcium is an important aspect, but perhaps think about getting that more from yogurt, which somehow didn't seem to have as much of an impact on breast cancer as milk did. I can't answer the question why that is. That is this one large observational study. It doesn't mean it's a cause and effect. It's an association that was observed. So it requires more ongoing observation. But again, it brings us to the modification and don't do anything in extreme.
Mm-hmm.
So that was one study. There was another study in the Journal of Cancer that suggested that fiber-rich foods were protective both premenopausally and postmenopausally. So having more fruits, vegetables, high fiber, other foods like legumes, nuts, things like that. Kind of like the health food that we always talk about, but here's a study that actually showed a reduced risk of breast cancer with that. And then there was another study yet that was, I don't know if it's actually being published, but I read the pre-published data that was done through researchers through UCLA. And it was based on a study that was initiated in the 1990s through the Women's Health Initiative. And they followed tens of dozens of women over 2 decades. And they found that there's a significant benefit to a low-fat diet in terms of breast cancer incidence and breast cancer deaths in women who are on a low-fat diet, especially so in women who have, I guess, it's what we call metabolic syndrome characteristics. So the bigger waistline, diabetes, blood pressure, cholesterol kind of scenario, those women in particular benefited the most. So it's interesting because a lot of those women who were put on the low-fat diet, that diet entailed the fiber-rich diet that I just referred to. So it sort of complemented what that study showed. So there was huge benefits to high fiber, low fat, and perhaps lower cow's milk. So that and the less alcohol. Red meat is also something that we discourage, especially well done or charred red meat. Has an increase in incidence of colorectal cancer and probably breast cancer as well, but that's not as well defined as colorectal cancer.
Okay.
So yes, our diet has a huge impact on the average risk.
I have a question just in regards to the milk. So you mentioned sort of swapping out maybe a bit of cow's milk for soy milk. And I've always wondered about soy milk and then that's effect on your hormone levels and how that would affect. So, okay, you're shaking your head no. So yeah, can you talk about?
It was a thing. It was a thing that was discussed for a long time. I actually emailed our dietitian this morning, Leslie Beck, just to confer with her to confirm that I am saying the right thing. And she said, absolutely, soy milk is not a problem. There are certain soy isoflavone supplements that the jury is out on, and I told her I wouldn't be talking about it, so it didn't matter, but I am. So supplements, talk to your dietitian about, or your doctor if they have more knowledge. And if anyone has specific questions about that, I can certainly circle back and get you answers on that. But she reassured me that the studies are quite fine with soy milk, and soy milk is very healthy.
Okay, that is great to know. Hopefully it wasn't just me who always wondered that. And that sort of goes along maybe with hormone replacement. I know women in menopause wondering what to do. So do you have any advice there?
Yeah, so there's been, okay, it's actually quite interesting because the study I referred to before, the Women's Health Initiative, was a study that was started in the 90s, and it was stopped very abruptly in the early 2000s because of an increased incidence of many conditions, including breast cancer. So women, millions of women, suddenly stopped taking their hormones because they were deemed to be dangerous, caused heart attacks, strokes, blood clots, and breast cancer. And so hormones got a bad rap. So for decades after that, nobody took hormones, and there were issues with that. But the study data have been reanalyzed many times. And what we've learned from this data from that study and ongoing studies is that hormones can actually be okay. And I'll explain that. Women take estrogen in order to relieve their symptoms of menopause, the hot flashes and other menopausal symptoms. Taking estrogen alone can increase the risk of cancer of the uterus. not good. So we add a progestin to that, and the progestin doesn't allow the cancer of the uterus to develop.
Okay.
The combination of taking estrogen and a progestin together for 5 years or less is not deemed to be an issue, but the risk of breast cancer goes up after those 5 years. At that point, it's important to have a conversation with your doctor to determine the benefit and risk of continuing with the hormone therapy, looking at what your own personal risk of breast cancer is, the benefit you derive from taking the hormones, your quality of life, etc. So at close to 5 years, I usually recommend that women try to wean down and see how they can manage off of it. But they can continue knowing that there is an increased risk of breast cancer, but it's a personal decision they make. The interesting change is the knowledge now that by taking estrogen alone, so that's only for women who've had a hysterectomy. In women, we don't have to worry about getting uterine cancer. So by taking estrogen alone, it reduced the risk of breast cancer.
Wow,
How
that's
cool is
so
that?
interesting. Yeah, and that maybe a little benefit if you've already had to deal with
So
other
the
issues.
benefit is you treat your vasomotor symptoms of menopause, all your symptoms, your hot flashes, your quality of life goes up. Your breast cancer risk is not just neutral, it goes down. So
Wow.
estrogen alone is fine.
Okay.
Okay, so that's the news on hormones. Don't be afraid of hormones. And going back to the combination of estrogen and progesterone, there are different types of progesterones. So the type you take, whether you take it daily or cyclically, which means you would get a withdrawal period, or the actual type of medication. There's what we call like the bioidentical, more natural type hormone. We think that there's a benefit in terms of breast cancer, not being as high as harmful for breast cancer relative to the older style progestins. So the type you take, how you take it, the dose you take are all relevant in terms of your risk. So don't be afraid of hormones. Better to talk to your doctor and make sure that the combination of what you're taking is the best one.
Okay. I think that's really useful. And I think maybe a lot of women wouldn't know that because it's hard to keep on top of all of the various studies, I think, from time
For
to
sure.
time. Well, we have some questions coming in. I saw that someone had raised their hand. If you have a question, you can put it in the Q&A or the chat and I'll see it. And so one of the questions we have already is, what defines a dense breast? Is it size or weight? How does one determine if they have dense breasts?
That's a great question. So dense breast tissue is identified on a mammogram. And breast tissue is made up of fatty tissue, duct tissue, glandular tissue, and fibrous tissue. So the more less fatty tissue, more dense fibrous tissue, and it just shows on a mammogram, but we can't differentiate that from cancer tissue. It looks the same, which makes it easy for a cancer to hide within that breast tissue. And there is a way of the radiologist can grade the approximate percentage of tissue being dense, and when it's more than 75% dense, it's considered dense tissue.
Okay.
Dense breast tissue, yeah.
Okay. We have another request for the links to the studies you're referencing, which we will. I will send an email out to everybody here that's watching this webinar with the links to those studies. I think that would be interesting. Another question we have is, does vitamin D offer benefits for breast cancer risk?
Excellent question. When vitamin D was first purported to have all these wonderful health benefits, one of the potential benefits was cancer reduction. Specifically for breast cancer, you know what, I'm happy to get back to you on that specifically. I'm a big proponent of taking vitamin D, primarily for bone health. There is some association with cancer reduction, not a cause and effect. So the latest on that, I'm sorry, I do have to get back to you on that one.
Sure. We can always include that answer too after the webinar is over. All right. Well, that's all of the questions we have. So I do have a slide we can share just to maybe go over some of the tips that you had shared, Dr. Weiss. So I'll just bring that up. And Okay, so
Okay, so get your regular screening. Don't let COVID stop you. Learn your particular risk for breast cancer and whether genetic testing is right for you or whether further imaging is appropriate for you. Limit or avoid alcohol. Eat less red meat, more fruits, vegetables, whole grains, and legumes. Maintain a healthy weight, especially after menopause, and stay physically active. And most of all, speak to your doctor. Have a relationship with your doctor. Right now during COVID, no, you probably can't get seen on a regular basis, but you're certainly able to connect with your doctor by phone. And I think it's really important to not neglect all the other aspects of your health.
we have another question. Actually, a couple here. After menopause, are self-exams still important? My doctor says they don't really work.
Yes, I was brought up in the era of doctor doing exams and patients doing monthly exams, and I'd go into great detail teaching patients at a young age to learn what their breasts feel like, so if there's a change, you would know about it. Not only are they not being advised from the higher ups because we're finding lots of non-significant benign lesions that are creating a lot of anxiety and a lot of unnecessary tests, but medical schools are telling their students not to be doing routine breast examinations either on women. I can't get into that. I'm old-fashioned. I still do breast examinations on all of my patients. I think it's personal. If you have lumpy breasts, then it's really difficult to discern what's new and what's not new. And truthfully, a mammogram will pick up an abnormal lump long before you will be able to feel it. So if you're getting regular mammograms, chances are it will be caught. But it's a personal thing. So, it's not being recommended from officially true.
Okay. Another question we have is, can dense breast tissue become less dense once you enter menopause?
Yes, absolutely. So that's why mammograms are not routinely done through the Ontario Breast Screening Program under age 50, because premenopausally, your breast tissue is definitely dense. And as you lose your sources of estrogen, the tissue becomes less dense and more fatty. And the mammograms are better able to penetrate through the tissue to see what's going on there. So yes, it does happen. But there are still a significant number of older women that still have breast tissue that's dense, yes.
Okay. And how often is screening recommended for postmenopause?
Well, at Medcan, we do it every year.
Okay.
Okay, and we do recommend it on a yearly basis.
Another question we have is taking almond milk better than cow's milk?
Probably. I'm saying probably. So it's not that almond milk is good, but we're saying reduce the cow's milk. I'm not saying eliminate it. I'm just saying if you're a large milk drinker, replace it with soy ideally. But if you don't like soy, then almond milk's fine. You still get nutrients and yeah.
Okay. And if you have had a hysterectomy but are not menopausal, are you at a higher risk for breast cancer?
No.
Okay.
No, absolutely. Actually, it's less risk, because if your ovaries were removed, that person didn't discern whether the ovaries were removed, but that is one of the preventative means for breast cancer in people who carry the gene. Oh, I see that she wrote her ovaries are still in. Probably not a significant, no difference, but in people who carry the BRCA gene or have a high risk gene, having a prophylactic mastectomy obviously reduces the risk, not to zero, but about 95% reduced risk of breast cancer after mastectomy, and removing the ovaries also reduces breast cancer risk if it's done before menopause. But if your ovaries are in, no.
Okay. And is there a higher risk of cancer for those that have fibroadenoma?
Fibroadenoma?
Thank you.
A fibroadenoma is a benign lesion in the breast. And some people do say that benign breast tissue abnormalities like fibroadenoma might increase your future risk of breast cancer, but fibroadenomas do not turn into breast cancer.
Okay. And my mother died of breast cancer at 64. Is there anything special that I should watch out for and do?
Yes, you may elect to speak to one of our genetics counselors at Medcan. Our genetics team is superb. They'll go through your family history and determine if there are any other people in your family that may have cancers that could be related to breast cancer. So men with, so potentially melanomas, prostate cancer, ovarian cancer, and other types of cancers can be part of a genetic syndrome. And then they can determine if genetic testing is appropriate for you. Even if your mom's the only one, you can actually elect to pay privately for genetic testing for breast cancer. So you don't have to qualify for an OHIP screen. You can just go and pay for it, and we can screen for you. And aside from that, you'd be at average risk, and then you can try to implement all the other things we talked about, and that's what you can do.
I think this has been so helpful, and these were such great questions from our audience here. So thank you, Dr. Weiss, for hosting this webinar. It was fantastic. I'm going to just, before we go, bring up a couple of other things happening at Medcan. So I'll just share my screen once again. And So just as a reminder, I spoke about this at the beginning of the webinar, but in 2 weeks, we'll have our next Medcan Presents webinar. That's on October the 6th. It's about the annual health assessment. So if you've been wondering about that, that's a great sort of follow-up to even this topic here, and a great chance to talk more with one of the doctors about breast cancer or any other of your concerns. You can attend this webinar to find out more about it, and you can email your questions in advance to chrisshulgin@medcan.com. The registration link is there. You can also find any of these webinars, including this one, on Medcan's YouTube channel. So this webinar, if you want to reference again or share with a friend, it will be up by tomorrow on the YouTube channel. And then as well, Medcan sponsors Eat, Move, Think, the podcast, which you can find wherever you listen to podcasts. And the most recent episode was episode 32, which came out yesterday, and was about rethinking obesity. And Medcan's Dr. David Macklin interviewed weight management pioneer Dr. Arya Sharma. There's a link there for the episode, but you can listen to it on any podcast platform. So thank you everyone for attending. Thank you, Dr. Weiss. Are there any final words you wanted to leave our guests with?
Thank you everyone for listening. And for the questions I couldn't answer specifically, I will definitely get back to Chantel with those answers. And I wish you all good health and stay safe.